We've all periodically suffered these little injuries and have recovered from them, whether it was a scrape on the knee from a tough game of football, or soccer, if you prefer, or rolling your ankle while wearing heels. However, there have been instances where seemingly unimportant events have turned into unimaginable outcomes, like being left in a coma for months, needing numerous skin transplants, or even passing away. Number 10. A skin graft follows a paper cut by Heather Harbottle in 2020. This mother, 49, came dangerously near to passing away after a flesh-eating bug entered her body through an untreated paper cut. She had no idea that such a minor annoyance would turn into necrotizing fasciitis, a condition that kills surrounding soft tissues as well as skin and muscle. The paper cut on her left hand was the beginning, and it quickly spread to her armpits and heart. She was consequently sent to the hospital swiftly, and fortunately avoided having her arm nearly amputated because the medical staff decided to perform a skin graft instead. Number 9. Another paper cut turned septic, says Michael Berger. Another dreadful case where a very slight paper cut resulted in considerably more alarming problems is when 46-year-old Michael Berger from New Jersey developed sepsis and lapsed into a 3-week medically induced coma. This is an unhealthy reaction to an infection that will probably result in organ failure. The finger cut that had become infected and spread throughout his entire body was what caused this reaction. He had a 50% chance of surviving, according to the doctors. Thankfully, he was admitted to the hospital's widely respected sepsis program. He is still with us now as a result of that. Number 8. Orange peel causes gangrene, claims Bobby Leach. Daredevil Bobby Leach perished after sliding on an orange pill despite surviving a Niagara Falls dive. The next step completely returns us to 1926. When Bobby Leach slipped on an orange peel and broke his leg while touring in New Zealand, his otherwise uneventful trip came to an abrupt end. He hastily brushed this damage aside, but his leg quickly grew infected, and the infection gradually progressed to gangrene. Amputation was the only option available to him at the time because there were no advanced hospital treatments. He would, however, never fully recover from his wounds and passed away soon after. The fact that Leach was just the second person to descend Niagara Falls in a wooden barrel and that his death was caused by a simple fruit skin is even more odd. Number 7. Callum Jones. Fatal blood clot from sprained ankle. Callum Jones, 27, slipped on a wooden bridge in October 2021 while calmly walking his dog. He subsequently sprained his ankle. He was transported to the hospital as his discomfort started to get worse, and there an ankle fracture was discovered. He was given crutches and his foot was put in a protective plastic boot. At his subsequent session, he was informed that he had severely sprained ligaments and tendons. 2 days later, he was having chest and shoulder pain and was having trouble breathing normally. Over the phone, he spoke with his neighborhood doctor, who merely gave him the diagnosis of pleuritis, a sickness that affects the lungs and results in chest pains. Jones soon passed out in his home and was taken to the hospital where he succumbed of a pulmonary embolism, or clogged blood artery in the lungs. This was a direct effect of the ligament damage-induced immobility. Number 6. Alex Bray's skin-eating disease is caused by a broken toenail. One night, this 18-year-old New South Wales teen woke up with agonizing pain in his knees. Alex Brays was taken to the hospital by his father right afterwards, but the doctors thought they were caused by sports injuries and told him to return the next morning for an ultrasound. However, when the two arrived at the hospital at 8 a.m., there were no doctors on duty to review the results of the procedure, and his vital signs were not checked. Bray's knees had grown excruciatingly uncomfortable by the time he got home, so he dialed 000, the same as 911 in America. Sadly, no ambulances were available, so his father had to take him back to the hospital himself. He was wheeled into the building when he arrived, and only seemed to be semi-conscious and unable to speak clearly. He was then diagnosed with necrotizing fasciitis, the lethal, skin-eating condition that was previously stated. This youngster died as a result of the broken toenail that caused it. Alex Brays was helicoptered to a hospital in Sydney, but the next day he tragically passed away from a heart arrest. Number 5. The few blows that killed renowned stunt performer Harry Houdini. Houdini was a master of daring escapes and one of the most renowned and respected magicians and escape artists of the 20th century. Houdini would, however, give one more performance on stage at the age of 52 before passing away from 2 severe hits to the stomach. Houdini gave a speech to some pupils on October 24, 1926, 12 days before he passed away on October 31. He bragged about how powerful his abdominal muscles were, saying they could withstand powerful blows. In order to test this idea, one of the inquisitive pupils suddenly delivered 3 or 4 powerful punches towards Houdini's stomach. Houdini didn't have enough time to prepare for these strikes, but he ignored the discomfort and even performed on stage for the final time. Houdini was unaware that the punches had in fact ruptured his appendix. He did, however, just have some minor discomfort and stomach cramps at that time. The only time he realized something was terribly wrong was when he became unwell and feverish on the train to Detroit. He was promptly admitted to the hospital, where he underwent unsuccessful medical procedures. His body was poisoned by the ruptured appendix, and he passed away quickly. Number 4. Stubbed toe caused organ failure. According to Keith Clark, we've all accidentally stubbed our toe on an inconspicuous object, but Keith Clark, a 59-year-old father of 2, died as a result of it. While on vacation in Florida, he went swimming in a pool that resembled a coral reef. All around the pool, large boulders with living coral embedded in them were arranged in clusters. On one of the pieces, Clark accidentally stubbed his toe, but he didn't pay it any attention until 3 days later, when he passed out at an airport while returning to Manchester. He was immediately sent to Central Florida Regional Hospital, where septic shock and organ failure were discovered. He was transported back to England in an air ambulance on July 2, and medical professionals were compelled to amputate his legs below the knee. However, it was too late. Just 8 weeks after stubbing his toe, Clark would pass away from multiple organ failure brought on by a bloodstream infection. Number 3. Brittany Cecil. Hockey puck that flies becomes fatal. Brittany Cecil went to an NHL hockey game on March 16, 2002, thanks to tickets her father had bought for her as an early birthday present. The player who made this mistake would end up dying after the puck was deflected off an opponent's stick during a routine slap shot. Cecil was wounded in the head, just above the snout, when it flew into the lower bowl seats of the hockey rink. When she was transferred to the hospital, she seemed alert and appeared to get better the following day. However, a ruptured vertebral artery that caused clotting and brain swelling went undetected by a CT scan that was done on the patient. Cecil passed away 48 hours later, on March 18, only 2 days before her 14th birthday. Safety netting was installed around the NHL arena as a result of Cecil's startling and terrible death, and he continues to be the lone fan fatality in NHL history. Number 2. Jasmine Beaver. Stomach hairball causes death. A 16-year-old teen dies after consuming too much hair due to Rapunzel syndrome. Jasmine Beaver, a 16-year-old student, passed out at her college in 2017 and was sent home to rest. She was transported to the hospital as enormous, enigmatic red blotches started to form on her skin, and medical staff soon found themselves fighting to keep her alive. Even though they were able to keep her alive for 15 minutes, Beaver would tragically pass away that day. Her stomach had a hairball that created an infection that ultimately led to her death. She developed peritonitis, an inflammation of the thin layer of tissue on the belly, according to a post-mortem investigation. Beaver had been chewing on her hair for years, which was probably Rapunzel syndrome in action. A big hairball had gathered in her stomach as a result of her body's inability to pass it through. Number 1. Sam Ballard. Slug ingested leads to paralysis. Sam Ballard, the man who swallowed a slug. The tragic story. Sam Ballard, a 19-year-old from Sydney, Australia, was drinking with friends in 2010 when they noticed a slug moving across the patio's concrete. He accepted the challenge from his friends to pick up and consume the slug. Nobody could have predicted that this seemingly innocent, albeit crude, deed would have a fatal outcome. Ballard originally felt fine despite this. But a few days after eating the slug, he started to feel sick, was quite weak, and had excruciating cramps in both of his legs. Doctors told him and his family that the condition was actually a rat lungworm disease that he had contracted from the infected slug, despite the fact that multiple sclerosis was initially thought to be the reason because his father had already been diagnosed with it. When this parasitic illness made its way to the brain, it would inflame the membranes that encircled the brain and spinal cord. Despite the fact that the majority of rat lungworm infections are minor and curable, Ballard's proved to be incurable. Ballard went into a coma shortly after his diagnosis and stayed there for 420 days. He was fed through a tube after waking up paralyzed and unable to move without great effort. Sam Ballard died in 2018 from medical complications after 8 years of this crippling disease.